Welcome and thanks for joining us. My name is Fiona and this is the second video in our series on employees' benefits in the new normal. In our first video, we touched on how the pandemic transformed the way we think about work and the impact on benefits and the overall employee experience. Today, we'll take a deeper dive into the topic of well-being, which has now become a central topic of discussion with our clients. We'll discuss how it's becoming more important than ever to improve the resiliencies of our workforce and also how these programs can be funded and made cost-efficient, given that most employers are now operating under increasingly uncertain circumstances.
A recent survey conducted by Willis Towers Watson found that employee stress, burnout, and mental health issues are employers' main concern for the workforce. So it's unsurprising that 65% then said that their top focus with respect to the employee experience with benefits was to focus on integrating well-being into the benefits package. In addition, more than half said that the improved employee well-being is the top measure of success for their benefits strategy. So it's clear that employee well-being is top of mind for employers. This was further validated when we checked in with our clients. Let's hear what they had to say.
This pandemic has made a lot of people realize that the health and safety of every individual and their families is the most important thing. And when you see people getting sick and also unfortunately passing on, you then realize, what's most important is that health and safety and well-being take center stage in our total rewards and benefits offering. And it's here to stay.
I think that the case on mental health has always been there even prior to the pandemic. If you remember, over the last maybe 2 years, 3 years, there's been a heightened level of awareness on mental health. And we've encouraged our team members to be more open and be more accepting. That's part of our thrust also towards inclusion, acceptance, and diversity.
On a total rewards package, bearing in mind how to now have a more strategic look on a total benefits package in terms of its relevance today, its responsiveness to the different needs of today, and of course, the cost optimization moving forward.
I think part of the conversation has to be how have your needs changed, and so what do you have today that that probably no longer work for you, and how can we shift that to something else that is more meaningful.
Really understanding where you are from a benefits perspective. So doing some sort of an X-ray, really understanding of where you are from a competitiveness perspective, from a compliance perspective, from a cost. And that analysis or baselining, as I would call it, is very, very critical.
We want to be doing things which help employees, but at the same time, we want to make sure that it is the things that they need and those that will make most impact and most difference to them.
It's encouraging for us to hear from these forward-thinking employers who recognize that well-being is no longer just about physical health, it's also about supporting the diversity of the workforce across dimensions of emotional, financial, and social well-being to enhance the overall user experience and journey with the organization.
When it comes to the costs associated with employees, after compensation, benefits usually is the next largest ticket item. HR is often under continued pressure to keep a lid on any cost increases and may even be asked to reduce benefits-related expenses. It's something that can keep them up all night. The pandemic has made cost optimization an even trickier balancing act, as employees have added concerns around work-life balance, mental health and financial stress. Employers have no intention on cutting back on employee support. So what's the best way forward?
The first step is to take a step back and understand what is driving your spend, so that you can cut back on some areas that are maybe underutilized and focus on areas that can have more of an impact. while employers can do this for their own organization and X-ray, as Drew said earlier. We also wanted to understand more about what's driving benefit spend from a macro, regional perspective in Asia Pacific. To do so, we look at the findings from Willis Towers Watson's 2022 Global Medical Trend Survey, which found that the medical cost trend in Asia Pacific is projected to increase to 7.6% in 2022 from 7% this year and 5.4% in 2020. In addition, over 6 in 10 insurers anticipated higher or significantly higher medical trend over the next 3 years. As expected, the pandemic has played a role in driving up costs. 37% said that this was a key contributing factor. Others are the higher cost of new medical technology, the profit motive of providers, and limited or poor networks. As a result, employers are turning to various cost management methods. One is cost sharing through member co-insurance or co-pay, which many insurers in Asia Pacific are adopting. However, many are also turning into cost management methods such as using contracted network of provider, pre-approvals, and even telehealth. Let's turn to some providers to hear more.
We have heard how employers are stepping up and responding to the challenges thrown up by the pandemic. On the other side of the equation, providers like insurance companies, healthcare providers, and third-party administrators also have an important role to play, and indeed a vested interest to partner with employers to ride out the pandemic and emerge stronger. What measures have providers taken to support employers and employees during this period of uncertainty? What are the longer-term changes to the benefits landscape that HR should take note of? To find out more, let's hear from Mr. Alvin Foo, Chief Corporate Solutions Officer, AIA Singapore, and Dr. Raymond Ong, Senior Doctor of Doctor Anywhere.
Digital employee experience is a very much a fact of life now. You have to do everything electronically on the portal, on the app. And I think that's a very important piece that how we support a lot of employees. You want to be able to, visit a doctor virtually. You want to submit claims electronically, and you want to get a letter of guarantee electronically as well. So I think that digital employee experience is something very important. It's something we support all our employees and all our customers with. So I think the acceptance, we've seen 7-fold increase post-COVID, and we think that it's very important to have that accessibility of healthcare. To me, it is an option, right? It's really, there are different conditions, and all some have to be physical examination, but I think having that accessibility of healthcare, I think is very important.
When it comes to telemedicine versus physical, right, we do see a shifting on, first of all, companies on our portfolio that we have both physical and telemedicine. We see a gradual shift from about 3 to 5% usage all the way up to currently 15-20% of all medical utilization. So there's an uptrend towards that. And we find that people are more willing to actually use telemedicine even for chronic disease management. And that's quite important in terms of cost containment in the future because, frankly speaking, there's a lot of usage of branded medications in the GP market when it comes to physical primary care. And that inflates a lot of costing.
We think inpatient is a very stable piece in terms of utilization. The medical inflation trends on the private space is about 10% per annum, and we see that continuously growing. Now, on the outpatient piece, we have seen volumes fall, especially on the upper respiratory tract infections and food poisoning as well. So we've seen those diagnoses fall very significantly. So we see that utilization on the acute side drop. We see chronic medication continue to rise. Doctors are dispensing a bit more for chronic conditions simply because they don't want the patient to revisit their clinic if possible. On balance, I think the burden of care is moving from the outpatient to the inpatient. It was good to have. I think it should be a must-have. It should form a foundational cornerstone of every employee benefits program. I'm a real advocate of mental resilience because I personally benefited myself, really helping people to have greater presence, to be calmer when they are in certain situations or in moments of stress. I think that's really important.
Employee well-being shouldn't be a hygiene factor. I think one good thing is to actually do a health charter and then both parties make commitment to each other to stay healthy and to stay engaged in the well-being program. Because if the employee sees a program but don't sign up, don't engage, right, it's just a waste of money. And I think employees also must take the active step to also be participative, and that's something that providers should also actively engage in the form of the way programs are designed. Create programs that are sustainable, put very high quality content on a digital platform. You allow it to be propagated on a large scale without additional cost to company. The fact is, right, that the medical industry has been asymmetric for the longest time. There's no proper information flow, and therefore, when you say that you get a good doctor, what is a good doctor? What do you define? Do you have claims-based? Do you have outcomes-based measurement of a private sector doctor?
Support pre-authorization as one way to kind of manage that cost. And just having that team of medical doctors and professionals, just having that oversight, I think is important. 20% of the bills today are above the 75th percentile.
This pre-authorization process, right, is a chance to actually have a neutral third party to come in, assess the claims from an evidence point of view, and ensure that, one, the cost is customary and reasonable. That's a very important point to make, that you are paying fair price, because no one knows. The average consumer is really at the mercy, as you mentioned, of the consultant.
Great insights from two leading providers in the region. So, to summarize, we have heard today from employers, providers, as well as findings from our own research. And while the picture is complex, different perspectives help to build a deeper understanding of it. Well-being will remain a focus for employers for the foreseeable future. As such, it can no longer be about window dressing or quick fixes. It can't be about organizing a series of programs or running a single initiative or ticking off a checkbox from the list. It is imperative for employers to integrate well-being as part of a broader HR strategy to stay relevant and competitive in attracting and retaining talent. It will take a multi-pronged approach. 1. Working with your employees, ensuring that benefits are designed thoroughly and integrated holistically with well-being and resilient program. 2. Working with different partners and vendors to navigate through the evolving benefit landscape. 3. Accelerating the use of technology and data to improve accessibility and delivery of benefits for a consumer-grade experience. Bringing these different facets together can help to truly modernize your benefit and, more importantly, make a difference in the life of your employees.
We have come to an end of this second part of this two-part video series. In the first video, we saw how the impact of work transformation was a catalyst of change to modernize the benefits program and employee experience. In this video, we deep dive to understand how employers can support well-being and build employee resilience while balancing the need to manage overall costs in a sustainable manner. We hope this will spark conversations at your organizations about how to create a modernized benefits program which delivers an engaging employee experience. Thank you.